Thank you for joining us for the 2021 Louisiana Virtual HPV Summit. This presentation will focus on HPV vaccination tools and resources presented by Jennifer Sienko, MPH. This educational series is made possible through funding from the American Academy of Pediatrics and is brought to you by the following partners: the American Cancer Society, the Bureau of Family Health School-Based Health Centers, Louisiana AAP, Louisiana Office of Public Health Immunization Program, Louisiana Primary Care Association, Louisiana Shots for Tots Coalition, Louisiana Vaccine Alliance, LSU Health Science Center Dental Program, and the Southeast Louisiana Area Health Education Center. Today's presenter is Jennifer Sienko. Jennifer is the director of the National HPV Vaccination Roundtable. Her primary responsibilities are communication and public engagement. Ms. Sienko received her MPH from the George Washington University, and prior to working at the American Cancer Society, she was the special assistant to the President's Cancer Panel. Ms. Sienko is also the co-founder of www.vaccinesandme.org, a nonprofit focused on providing accurate and accessible vaccine information in everyday language. Jennifer, the stage is yours.
Hello and welcome to a training on HPV vaccination tools and resources. Today we will talk about readily available resources for providers to use both in their clinics and with parents. I'm so pleased to be with you today. My name is Jennifer Sienko. I am one of the directors of the National HPV Vaccination Roundtable, and I have no financial disclosures. So we know increasing HPV vaccination rates, or any vaccination rates, can be very difficult. Before the COVID pandemic, HPV vaccination rates lagged behind those of other adolescent vaccines given at the same time. COVID only exacerbated this, and we now know that we are behind in vaccination across the lifespan. Fortunately, there are many resources available to help increase vaccination rates, not only HPV vaccines, but also other vaccines that you might get questions about. And I imagine that we'll get a lot of questions about COVID vaccination going forward. The first major category of resources I want to present to you today are those that are provider focused. So these are resources that have been specifically created for clinicians or people who work in and around health systems with payers or health plans who do quality improvement work. So these are resources that you wouldn't necessarily hand to a parent. They tend to be sort of more technical in nature, but some of our parents are very curious. And so everything I'm about to present to you is evidence-based, accurate, and can be shared. I just want to preface by saying that they were not developed specifically for parents. So, of course, I'm here representing the HPV Vaccination Roundtable, and I want to start off by sharing some of our resources, and specifically our clinic and system action guides. These are amazing action-based toolkits for physicians, physician assistants, nurse practitioners, and they include evidence-based actions that can help you directly increase the HPV vaccination rates in your clinic. You can find them on our website, hpvroundtable.org/action-guides. And we have them not only for our MDs and our NPs, but we have them for our nurses, our medical assistants, our dental providers, and also for small private practices and front office staff. We at the Roundtable are big believers that it takes a village, and that includes making sure everyone in your clinic or your health system is speaking from the same page around HPV vaccinations. We also have a specific toolkit for nurses at every practice level, and this is called HPV Prevention, Nurses Get It Done. It is also freely available for download on our website at hpvroundtable.org/getitdone-resources. And this includes not only a PDF that is divided into 3 sections, including an HPV 101, which has answers to more technical questions about the HPV vaccine, including how is it made, what are the ingredients, what are the side effects, and also an entire section on how to respond to parents' questions. So I highly encourage anyone interested in learning for themselves to check it out. But we also have a training webinar that accompanies this toolkit that was given by our colleagues at National Association of Pediatric Nurse Practitioners that helps NPs or other interested clinical leaders to present this to staff as a clinical training. So this suite of tools includes social media messages, a certificate of completion, the training module, as I mentioned, and is really great if you are looking for sort of comprehensive education for your clinic staff. We also recognize that our providers are necessarily focused on COVID. And so we've developed a suite of resources called Catch Up Now, or Get Back on Track with Routine Vaccinations. This is the top half of an infographic that we have developed on why it's so urgent that we work with health systems to close the gap on adolescent vaccination. And we also have short videos, social assets, and white papers. So if you are someone who works within a health system or is interested in collaborating with your health system leadership, these are tools that exist to help you make the case for prioritizing catch-up vaccinations. Again, this is really available on our website, hpvroundtable.org, get-involved/health-system. I would be very remiss if I didn't mention sort of the OG of resources, and that is the CDC's website on all things HPV. CDC has spent significant resources and time reorganizing their HPV portal. And so they have it categorized by resources for clinicians, resources for parents, and resources for partners. Their clinician resources include these handouts, such as Screening Won't Protect Your Patients. We call it the iceberg handout, but it also has the most up-to-date scheduling and dosing charts, evidence-based answers to parents' questions, and information on how you can boost your vaccination rate. If you are not familiar with this website or haven't been in quite a while, I would highly encourage you to check it out. It is www.cdc.gov/HPV. Another great resource that CDC has are their How I Recommend videos. And these are a suite of videos across all kinds of vaccinations, so not specific to HPV. These videos showcase providers telling how they themselves in actual clinical practice recommend vaccines. This library is searchable by vaccine type of question, and by provider type. If I am always singing the praises of these videos because I personally think it's so helpful to see and be able to model the behavior of someone who has successfully done what I'm trying to do. And that's exactly what these short videos do. And they're kind of hard to find on the CDC website, so I've linked to them here. But if you can go directly to the URL, or you can Google CDC How I Recommend to get to their video page. This website, HPV IQ, was put together by Dr. Noel Brewer at UNC and is a quality improvement. It's a website full of quality improvement tools and resources. So these are very specific tools to explore best practices, evidence-based practices for increasing HPV rates in a clinic. It talks about how you can use incentives to increase rates, how to generate and share data around rates, and also how to work with partners on quality improvement metrics. There is a great tab on this website about training. So if you're interested in evidence-based, research-backed methods for training providers on how to recommend, or for your own sort of self-learning, I would check out hpviq.org. And of course, we wouldn't be anywhere without the great resources of the AAP. So AAP has resources for its members and other providers on how to educate each other, how to talk with parents, and how to make practice changes. There are some great images, such as this "Vaccines are safe, here's what we know" image, and the AAP partners with the CDC on the HPV Vaccine is Cancer Prevention Champion. There is an entire toolkit that links out to not only AAP resources, but other partner resources available at this very long URL. But the AAP has been an incredible partner to our work on the HPV Roundtable, and should be a saved tab on anyone's website looking for vaccine resources. The second major category of resources I want to present to you today are those resources that were developed specifically for parents. Parents, caregivers, aunts, uncles, anyone who is involved in the health decisions of 9 to 12-year-olds. Now, many providers are also parents, and so these resources will probably be of interest to many of you. But again, I've separated these out so that it's easier to understand. These are resources that you should feel very comfortable either handing directly to a parent, directing a parent to as a website for further information, or when people ask you when you're out on a walk, "Hey, I know you're a doctor, what do you think about this?" You can feel comfortable recommending these resources because they're written in everyday language and their messages have been tested and are backed by evidence. So there are many kinds of resources. The two that we found have been most useful with parents have been handouts, something you can physically hand them either in the clinic or mail out to them as part of your reminder recall system, or posters that you can put up, and then also websites. If a parent is sort of hesitant about making a vaccine decision and say they want more time, it is really useful for you as the provider, the trusted sort of clinician, to say, here are the websites I use, here are the websites I would point you to. We all know that there are some less than accurate websites out there with vaccine information. So I don't like to tell people to just Google their question because they can get kind of sucked into a black hole of misinformation. But there are many, many, many websites that are really great resources of information. So I mentioned there are many, many websites, and rather than have 100 slides with screenshots of everything, I want to present to you our resource library. And on the next slide, I'm going to go through sort of how to find this information, but we at the Roundtable have a curated, updated resource library on our website. And you can go to this resource library and look for tools, resources, white papers, webinars, trainings. It's filterable by type of resource. It's filterable by type of audience. And we do our best to make sure that the information in there is as up to date as possible. So if you go to hpvroundtable.org and our resource library and click on filter and sort, you'll see all of these options. I've clicked parents here, and when I did that, it returns, you'll see here, 301 results. These include everything from PDFs to online webinars. We have short animated videos, links to our parent YouTube page, social shareables that you can download, and also many, many others. We not only feature our own products, but we feature those of our partners, such as Unity, AAP, CDC. This Vax Talk is a podcast together by Vaccinate Your Family. So if you have maybe patients in your clinic who are not excited about a .gov as a website or a resource, we have many, many partner resources that you can point them to that are built on the evidence base of the .gov, but don't have that necessary sort of connotation around this is a government-backed website. When you click on a link, it'll open in another tab and directly into that resource, and then you can go back to our website and keep searching. So I present this to you as a one-stop shop. There are many other resources, and I am very happy if you need to reach out to the HPV Vaccination Roundtable about if you're looking for a very specific resource, say something in another language for parents or an infographic, and you cannot find it on our resource library, please feel free to reach out to the HPV Vaccination Roundtable, and we will definitely work with you to help find what you need. So in summation, the links to resources, hpvroundtable.org for all things HPV vaccine related, but also for partner resources, cdc.gov/HPV has amazing resources, and I'm sure many of you have seen them. And it's always going to link to the most up-to-date dosing and schedule posters, as well as NIS teen data. The American Cancer Society has a really great parent-focused website at cancer.org/HPV. And I am pretty sure that everyone is familiar with the American Academy of Pediatrics resources for both providers and for parents. So I want to leave you with this quote from Nelson Mandela. So immunization has been a great public health success story. The lives of millions of children have been saved. Millions have had the chance of a longer, healthier life, a greater chance to learn,
Thank you for watching today's presentation.
to read and
we hope
write,
that it was
to move around freely
educational
without
and gives
suffering.
you ideas for
We
implementation.
know that a strong,
After viewing
confident
all the
vaccine
presentations in the series,
recommendation
please
from a
complete an
primary care
evaluation
provider, a
feedback
healthcare
form by
provider, a
scanning the
member of the
QR
healthcare
code
team
you see on your
is the
screen
#1
or
predictor
going
of
to
vaccination status. You have the power to protect your patients from vaccine-preventable diseases, and we have the power to help you with the resources, the evidence, and the answers that you might need.
HPV Summit.
Thank you so much. I hope that
Your
you have
feedback
enjoyed
is
this training,
valuable
and
as we continue to
am
plan
happy to be
future
contacted
events.
if you have any additional
In
questions.
addition, you will be asked for your mailing address. As a participant in the series, you will receive a copy of all presentations on a flash drive, in addition to several other resources. We hope this has been helpful to you. Should you have additional questions or want additional information, please reach out to the Louisiana AAP either by calling 225-379-7923 or emailing admin@laap.org. Thank you again.